All right, so today we're going to go over the pharmacology for renal and GU, and this is going to cover PowerPoints part 1 and part 2. We're going to get started with drugs for incontinence. There are two types of drugs for incontinence, and just a reminder, incontinence is the loss of bladder control. And the two types of drugs are anticholinergics and beta-3 agonists. So I'm going to start with our anticholinergics in this picture. And the MOA isn't written out because at this point we should know what an anticholinergic is, but I'm just going to say it. These are going to block and inhibit the activity of the neurotransmitter acetylcholine. And so it's going to inhibit muscarinic receptors that are on the bladder. So it's going to be an antispasmodic of the bladder muscles and then decrease bladder contraction so that you're not urinating uncontrollably. And so this is a Western scene when we have a train depot and like a water tower, water spout for the train. And so this water tower is kind of shaped like a bladder. And that's to help you just remember that these are for incontinence. And, you know, that, like I said, it's going to decrease those contractions in the bladder. So there's several drugs here. I'll start with our first one, oxybutynin. And so, again, I know I've used this a couple times, but it looks like ox butt. And so we have an ox and his butt is forward. However, just remember the brand name, which is ditropin or ditropan. He's wearing a diaper. So diaper for dye, and he's next to a bedpan for ditropan. So it's another way to remember it. The next drug is tolterodine or detrol. So detrol is kind of like depot. Detrol depot. So that's that. The next drug is darafenacin. So darafenacin to me looks like it has the word dare and fence in it. So we have a daredevil who's jumping over a fence, darafenacin. Next is solifenacin. And so solifenacin starts with sola, like solstice. So we have like the summer solstice going on here. And again, it's sort of by this fence. And then next we have trospium or sanctura. So we have a train. It's got a couple different cars here. Sanctura sounds like the word sanctuary, like an animal sanctuary. So we have an elephant riding in this car, like an animal sanctuary, sanctura. In this other train car, we have topaz gems. Topaz kind of sounds like Toviaz, which is the brand name for basotiridine. So those are all the drugs that are anticholinergics for incontinence. The adverse effects of all of these drugs are hypertension. So we just have little blood pressure, increased air over here, and then dry mouth. And of course, other dryness. So that's why there's a bunch of cactuses in this picture. So, like I said, the other category for incontinence is your beta-3 agonists. So there are beta-3 receptors that are found in the bladder. And when they are stimulated, that's why it's called a beta-3 agonist, it will cause the bladder muscles to relax, therefore lessening urinary urgency and incontinence. So in this picture, we have a hippie, and instead of holding up 2 fingers like, peace, he is holding up 3. That's to help you remember your MOA of beta-3 receptor agonist. And so he's holding a mirror, and he's begging. He's out, he's got this little pan in front of him begging for money. So he's holding a mirror and he's begging for Mira Begron. And then hippies, they just have good vibes. He's out there vibing for Vibagron. Adverse effects are hypertension, which is not shown, and then urinary retention, which is the inability to completely empty your bladder. So again, he's got a bladder on his shirt, and that's just to help you remember incontinence, but it could also help you remember urinary retention. So next I'm going to move on to following the PowerPoint. It's drugs for prostate disorders, and I'm going to skip this picture just for a moment, and we're going to move to our 5-alpha reductase inhibitors. And so the MOA for these is that they are going to inhibit the hormone 5-alpha reductase, which therefore prevents the conversion from prevents the conversion of testosterone to dihydrotestosterone, which is responsible for prostate enlargement. So when we inhibit 5-alpha reductase, the prostate will no longer enlarge. And also alpha blockers can relax the urethral tone. So the drugs for this is finasteride. And so this is a ride that has fins on it. So we have dolphins. So it's like a carousel, but instead of horses, we have dolphins. So a fin ride, finasteride. And then over here for the drug dutasteride, or dutasteride, I just see the word taste and I see the word ride. So this is a taste ride. It's one of those, pedal bikes where you eat stuff while you pedal down the street. And these are supposed to be walnuts because, I don't know, to me, the prostate kind of looks like a walnut. And so that's just to help you remember that this is for prostate disorders. The adverse effects are impotence. So we have this really sad penis here, and decreased libido. Same thing. Decreased sex drive. So then another drug for prostate disorders are your alpha blockers. And we've seen this image before. I just added 2 new drugs to it, but I'll go over all of them again. So the MOA for alpha blockers is that they are going to block adrenaline's action on alpha-1 adrenergic receptors. They're going to cause relaxation of the smooth muscle in blood vessels and the prostate. And keep in mind, they block alpha receptors everywhere. So they can cause like vasodilation all over the body, which is why they can treat hypertension. So the drugs, we have a dachshund here. He's peeing on a plant. So dachshund is for doxazosin. He's peeing on a terracotta pot. So terracotta for terazosin. This is like a primrose plant, primrose for prazosin. And then he is flowing to the max for Flomax or tamsulosin. And then here are our 2 new drugs. We have a grain silo for silodosin, and then some alfalfa plants growing for alfluzosin. And so the adverse effects are hypotension and dizziness. So there should be like little dizzy stars around his head. And then I remember in one of my other examples, the owner of this dog was like, "Oh, honey, don't pee on that plant." So honey, hun, hypotension. So another drug for prostate disorders is this tadalafil, which is also Cialis, and it's used not only for an enlarged prostate, but also erectile dysfunction. So it's in this big picture that are drugs for erectile dysfunction, which I will cover in a little bit. But right now, I'm just going to talk about tadalafil. So this is a PDE5 inhibitor. It's going to increase cyclic guanosine monophosphate, which is abbreviated as cGMP. And the net result is smooth muscle relaxation. So again, PDE5 inhibitor, 1, 2, 3, 4, 5 hills, and it increases cyclic guanosine monophosphate. This is a bird. It's called a crested guan, and it's riding on a bicycle. So that's your cyclic guanosine. Anyway, if you are giving this drug for the BPH, benign prostatic hypertrophy, you're going to give it in a smaller dose. So like 5 milligrams daily. Whereas if you were using tadalafil for erectile dysfunction, you would give a higher dose, and it would be like 10 to 20 milligrams, and it would be as needed before sexual activity. So I wrote I have the walnut here to remind you that this is not only for erectile dysfunction, but it's also for that prostate. And then it's a tadpole or tadalafil. And like I said, I will come back to the rest of these erectile dysfunction drugs in a minute. But I'm going to move on to drugs for prostate cancer. So this is an anti-androgen. It's a Biratone or Zytiga. So what I have here is Zytiga. We have a zebra tiger. And we're looking through some binoculars, and we see, not only do we see the zebra tiger, but we see the number 17. That is to help you remember that this is an enzyme inhibitor of CYP17. I see the 17, C17. And this is an enzyme that is required for androgen synthesis. And so when we inhibit this enzyme, we're going to increase mineralocorticoid production in the adrenal glands, which is going to it's going to decrease your androgens, which is going to decrease the cell growth of cancer in the prostate. There's a lot of, so to remember that this is for cancer, prostate cancer, we have our cancer ribbon here. There's a lot of adverse effects. We have hyperlipidemia, so lipidemia, he's got lips. Hyperglycemia, so there's candy here. Increased LFTs, which he's lifting his tail and it says LFT on it. Bone marrow suppression, there's the bone. Hypernatremia, so increased sodium, and then hypokalemia, and hypertension, so we have our blood pressure. There are other anti-androgens that are also used for prostate cancer. However, they have a slightly different mechanism of action, which is why they are in a different picture. So the other anti-androgens, these are going to be competitive antagonists of testosterone, which again is just going to prevent the cell growth of cells in the prostate. So we have a bedroom here, and there's stuff in the room that are going to symbolize our drugs. So we have Casodex, or a deck of cassette tapes is what I was going for. So this is a cassette tape, Casodex. And we have a flute or flutamide. It's poorly drawn flute. And then for nylanodron, I was thinking like nylon. So we have like a pair of like pantyhose, nylon pantyhose on the bed. All of these have really similar adverse effects. They all have hot flashes, which is why this guy, he's got like flames on his cheek for hot flashes. And they also have gynecomastia, which is basically your man boobs. So he's got gynecomastia going on. And then both Casodex and this nylandrone have lung issues. So like Casodex has interstitial lung disease as an adverse effect. And then the nylandrone has interstitial pneumonitis. So interstitial lung disease and interstitial pneumonitis. Not really sure if there's a difference there, to be honest with you. And then flutamide has the adverse effect of decreased libido and impotence, which it's hard to see, but there is a little sad penis on this flute case for impotence and decreased libido. And then they also all have either liver injury or increased LFTs. So there's a liver with a knife going through it. So that's that. Next is these are still for prostate cancer, but they are gonadotropin releasing hormone agents. So in this picture, we have a leopard. He is trying to pounce on this pituitary gland, but he is being blocked by an ogre. So the leopard is demonstrating leoprolide, and this is a gonadotropin-releasing hormone agonist, whereas the ogre, for Orcovix, is a gonadotropin-releasing hormone antagonist. Remember that agonists are things that kind of increase the secretion of something, and antagonists block. So it's kind of strange that these drugs are used like this, but the leoprolide is going to kind of stimulate the GnRH in the pituitary. It's going to initially cause a flare of the disease, but somehow it follows it by suppressing it. And ultimately, it's going to lower the amount of testosterone. And then your Rugalix or your Orgovix, the ogre, he's an antagonist. He's blocking the leopard from getting to the pituitary. And so that's going to, somehow also lower testosterone. So the adverse effects for the leoprolide are injection site reactions, hot flashes, and then emotional liability, which is not shown. And then the other drug here has hot flashes, so there's a flame, liver dysfunction, so there's liver, and then glucose intolerance, which is not shown. And then, again, this is just our pituitary. I don't know if I said that, but yeah. So then we're going to go back to our drugs for erectile dysfunction, which are all of these. So like I said, these are all going to increase cyclic guanosine monophosphate. So we have our cycling guan, and the net result is smooth muscle relaxation. So these are PDE5 inhibitors. We have 5 hills to help you remember PDE5 inhibitor. And each hill has something different on it to help you remember a different drug. So over here, we have a van on a hill, or a vanafil. They all kind of rhyme. Here we have a slide on a hill for sildenafil, sliding down a hill. Here again, we have tadalafil, a tadpole on a hill. And then this is like a gardening, so garden for vardenafil. And then over here, this drug has a different MOA. This is the one Caverject, so I think like a cave or a cavern for Caverject. And this is the one that you have to inject right into the penis before sexual activity, and it is a prostaglandin analog. And its adverse effects, as you can imagine, are pain and then priapism. All of these have priapism as a adverse effect. And so that's a longer than usual erection. And then other adverse effects are headache. So the guan has a headache with the symbols around its head. And then hypotension. And then this is huge key here. Do not use these with nitrates. It can cause fatal hypotension. And so just to give some examples, if you have a patient who comes into the ER with chest pain, you are not going to give them nitroglycerin if they have taken this drug recently. So next we talked about drugs for UTIs, and these are all antibiotics that we've covered before. You have ciprofloxacin and levofloxacin, which are your fluoroquinolones. You have nitrofurantoin, you have your Bactrim, and then you have fosfomycin. Those are your, like I said, oral. And then your IV, you can also do Cipro and Levo, and then ceftriaxone and gentamicin. So I'm just going to quickly show the original pictures for these. So these are our fluoroquinolones. The MOA is that they bind to GNA gyrase. Again, we have this guy who's sipping on a drink for Cipro, and our lever for levofloxacin. And the main adverse effects for these I want to say are your connective tissue dysfunction, I'd say is a huge one. People on Cipro can like tear their Achilles tendon and stuff like that. The next drug was your nitrofurantoin, which I'm going to show a picture in just a second. Bactrim is a sulfa drug. So this guy, he's really hairy. He needs his back trimmed and he's sitting on a sofa for sulfa. These can cause rashes. Yep. And then gentamicin. No, sorry. I'm going to show you this picture I made way back in our infectious disease module. It's kind of goofy, but it helped remember a lot of the bacteria that cause UTIs, and then there are some of the treatments. So phosphomycin to me sounded like a foosball person. So that's what this main thing is. It's one of those foosball people for phosphomycin. And you know, within this foosball person, he's got a lever. And so like one of the levers looks like a club for Klebsiella. The other lever has a rug hanging off of it for Pseudomonas aeruginosa or originosa. And then it's a lever. So you treat it with levofloxacin. And again, the foosball man is hairy. He needs his back trimmed for back trim. The head is a light bulb for like Eureka or Escherichia coli. And then I liked this saying, if you have a fury in your groin, use nitrofurantoin, which it's pronounced toin, but at the time I did not know that. Anyway, when you have a UTI, obviously you have a fury in your groin. And then this guy, he's sitting for Cipro, he's sitting, and that is, you can use that for this, whatever these gram, I think those are gram-positive bacteria. And these are all pink because they're all gram-negative bacteria. So I don't know if that was helpful or not, but I just want to share that. So another drug you can use for UTIs is gentamicin. Gentamicin is an aminoglycoside, works on the 30S ribosome. It has renal dysfunction as a big adverse effect. And then you can also use ceftriaxone, which, as a reminder, is a third generation cephalosporin. So you have a triax for ceftriaxone right there. There are a lot of things you can do for UTI prophylaxis. So again, you can use Bactrim at bedtime. You can use nitrofurantoin daily. You can use cefalexin, which is another cephalosporin. That's your first gen cephalosporin. And then phosphomycin. And then here's a new drug for UTI prophylaxis. And I have a picture for this. And it is called methenamine hippurate or Hyprex. So I thought this sounded like hippo and Pyrex together, Hypirex. And so we have a hippo in a Pyrex container. And he's surrounded by urine because this is going to hydrolyze nitrate and formaldehyde in acidic urine. Adverse effects are dysuria and nausea, which none of those are shown in the picture, but I don't know, somehow that prevents UTIs. And then another drug for UTI. This is for symptom therapy only, and it is your azo or phenylpiridine, whatever. This is a pyramid. It's an Aztec pyramid. Aztec pyramid for azo, Aztec, and then pyridine pyramid. And it's surrounded by this canal, and rather than the canal being filled with water, it's filled with urine, or like this orangish red colored urine. That's because that's one of the adverse effects. Not really an adverse effect, but just a pro tip. So this is just an anesthetic. It doesn't have any antibiotic properties. Adverse effects are these various types of anemia. So that's why there's those little red blood cells within the canals. That's help you remember anemia. So now we move on to acute kidney injury, and I don't have a lot of pictures for this, so I'm just going through what I have. So complications of acute kidney injury are hyperkalemia, so increased potassium, metabolic acidosis, hyperphosphatemia, so increased phosphate, and then hypermagnesemia, or high magnesium. Common causes of AKI are your IV contrast dye, your aminoglycosides and vancomycin, ACE inhibitors, NSAIDs, diuretics, cancer chemotherapy, and then your triple whammy, which is your NSAID, your ACE ARB, plus your diuretic. So just a side note is a sodium bicarb infusion can help prevent that IV contrast cause of AKI. So sodium bicarb I showed in the GI module as the Batmobile, because sodium is abbreviated as Na. And so when you think like the song, na 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 Batman, yeah, it's a bicarb, like a bat car. And it's sodium. And then here we go. Drugs to treat AKIs is your loop diuretic. So we have furosemide, torsemide, and bumetanide. So I have pictures of these from way back when. It was right here. So our loop diuretics. So in this picture we have Ethan, and he's holding one of those bubble blowers. It's a big loop, and he's sitting next to this cat who's very furry, and he's licking his bum. And there's also a torch. So torch for furosemide, the furry cat for furosemide, and he's licking his bum for bumetanide. And we don't have to worry really about this one, but it's going to inhibit chloride reabsorption in the ascending limb of the loop of Henle. Adverse effects are hypokalemia, which is not shown, renal dysfunction, which again, I don't think is shown, dehydration, hypotension, none of those are shown. So just remember. So treatment of hyperkalemia, because that's one of the major complications. I don't have pictures for these. You have calcium chloride or calcium gluconate. You have your sodium bicarb again. Oh yeah, So the calcium chloride and gluconate is only going to protect the myocardium. It's going to protect the heart. It doesn't do anything to actually reverse the hyperkalemia. Your sodium bicarb reverses the acidosis. You want to give insulin and glucose, which is going to help drive more potassium into the cells so that it decreases it in the bloodstream. And then sodium polystyrene sulfonate removes potassium from the GI tract. So those are all ways to treat hyperkalemia. To treat chronic hyperkalemia, I have a picture. Somewhere. Okay, right here. Chronic hyperkalemia. We have our drugs, sodium polystyrene sulfonate, or K-acylate, and then sodium zirconium cyclosilate, or Localyma. So zirconium sounds like your diamonds, your rings, and then we went to K Jewelers for K-acylate. So this dude, he's proposing with a colon ring. And that's because these exchange they have slightly different MOAs. But they both work in the GI tract, which is why the ring is shaped like a colon. your K-acylate is going to exchange sodium for potassium in the GI, and then this one is going to bind potassium in the GI tract. Adverse effects are just GI effects, so constipation, nausea, vomiting, hypokalemia, because you could eliminate too much potassium, and then edema. Drugs for electrolyte supplementation for people with chronic, we're still talking about AKI. So acute kidney injury, they will need supplementation of electrolytes. So you can give potassium chloride, you can give magnesium chloride, magnesium oxide, magnesium sulfate, potassium phosphate, and then you can also give desmopressin, which I have a picture of. So this guy here, this is Des, and he is pressing some logs. And he's pressing logs because that is an analog of vasopressin, which I believe dilates blood vessels. Sorry, vasopressin is another name for antidiuretic hormone. So it's going to decrease the amount of stuff that you're peeing out. And adverse effects is hyponatremia. So drugs for hyponatremia are your Vaptans. So I have a picture for that. And this is, the two drugs are Vaprisol and Samska. So this is a priest, or Pre-Sol, and I forgot to draw it, but he was supposed to be vaping for Vaprisol. And he went to Sam's Club for Samska. And when he went there, he bought a lot of water, excess water. And then instead of buying a V8, he bought a V2. And that is because this is a vasopressin, or a V2 receptor antagonist. And that allows the elimination of excess free water. So again, excess free water. He had bought a whole bunch of water. And the adverse effects of Samska are dry mouth, thirst, hepatotoxicity, and nausea. And the adverse effects of the Vaprisol are a headache. So he's got a headache, and then infusion site reactions. We are now going to switch gears and talk about chronic kidney disease. So we were talking about acute kidney injury. Now we're talking about chronic. So first of all, if we can prevent it, we want to do that. So preventing CKD involves avoiding nephrotoxins, preventing AKI, having good glycemic control, because we know that diabetics are more prone to getting chronic kidney disease, and then having good blood pressure control. So patients with CKD often get anemia. And so there are some drugs to treat anemia called our ESAs, or erythropoietin stimulating agents. And I have a picture for that. And this is way back in heme. I think I made this drawing. So remember, they're going to stimulate erythropoietin in your bone marrow, which is going to basically make more red blood cells. But the actual MOA is that it stimulates the division and differentiation of progenitor cells in bone marrow. So progenitor cells, I think pro sports, and it says division. So we have like the division of 1, 2, 3. These are people who are rowing, and that is for erythropoietin. And these are darts, or darbapoietin. Adverse effects are edema, arthralgia, headache, hypertension. And remember, these have a black box warning. This is a blackish box. When using these agents, a target hemoglobin above 11 is at an increased risk of death for cardiovascular events. So you can have a little bit lower hemoglobin, target hemoglobin when using these. And then just a note, roxadustat is an investigational ESA, but he said not to memorize those. So in addition to treating anemia, you can also give iron supplements. And I have an image to help remember all the different types of iron supplements. So these are in the bottom of this picture here. These are all different types of iron. So I think like this one is a 7 iron. So sucrose, iron sucrose, 7. They both start with S's. This is Iron Man for iron dextran. Those rhyme. This is like a gate, the fence on a gate. So ferric gluconate. A polysaccharide iron complex. That one's not in this unit. Carbonyl. Clear sulfate. This is like a straightener. I don't know if these are helpful or not, but anyway, those are your iron supplements. And then you can also give phosphate binders for CKD. So phosphate binders are here. They work in the GI tract, and they're going to bind phosphate in the GI tract. This little chemical molecule here is phosphate. Adverse effects are going to be GI issues like constipation. So here we have calcium carbonate. Like I said, it's our Batmobile. This is lanthanum. So this is a chrysanthemum, lanthanum. We have a car here with a 7 on it for sevalamer, 7, sevalamer. And then calcium acetate, I don't have a picture for, but they're racing around binding up phosphate in the GI. Patients on dialysis need to have vitamin B and vitamin C supplements. If they have hypertension, you treat them like any other patient with calcium channel blockers, beta blockers, diuretics, ACEs and ARBs, catapress, alpha-1 antagonists. Again, if they have hyperlipidemia, you want to treat it like everyone else. Statins and MABs. If they have diabetes, the only thing is to avoid metformin when their creatinine is less than 30. Another drug for CKD we learned back in heme, and it's pentoxifylline. And the original picture was this little flexible lady here because we had learned in heme that it just increases the flexibility of red blood cells. In this module, he said that the MOA is anti-inflammatory. So here's an anti-flame. It's a hemerologic and phosphodiesterase inhibitor and an antioxidative stress. But really, it just improves like the blood flow, basically. Adverse effects are nausea, vomiting, and bone marrow suppression, which is why her bone is sticking out right there. So those are all the drugs for chronic kidney disease. Now we move on to kidney stones. So some drugs that cause kidney stones are topiramate, acetazolamide, and ascorbic acid. To treat kidney stones, you have a lot of pain drugs: morphine, hydromorphone, hydrocodone, ketorolac or Toradol, and Proxen. So remember, these first 3 are your opioids. These 2 are NSAIDs. Ondansetron is a anti-nausea med, so is metoclopramide and prochlorperazine. These 3 are anti-nausea vomiting drugs. And tamsulosin we already talked about. It's the antispasmodic. And then last but not least, we have drugs for this Peyronie's disease, which is when you basically have a bent penis. And so this drug is a collagenase clostridium whatever. Basically, the reason why the penis is bent is because there's excess collagen growth. And so this is a bacterial enzyme that's going to dissolve that collagen. So I drew this picture very literally. You're going to inject bacteria into your bent penis, and it's going to solve the problem. You could have a local hematoma, swelling, pain, ecchymosis, and hypersensitivity from this drug. All right, and that, I believe, is all of the drugs that we've learned so far for renal, parts 1 and 2. Thanks for listening.